Hello everyone. For Nursing 447 Issues and Trends Facing Healthcare, my name is Huda Miludi and this is my presentation on evolvement of nursing education. One of the biggest trends in nursing 2020 is the growing number of nurses pursuing higher education. It is becoming the norm. The nursing school I graduated from 11 years ago with an ADN degree has merged with another nursing school in the area and is only offering BSN degree. From the textbook reading in chapter 2, Nursing Education Past, Present, and Future, we can say that the founders of the nursing profession have thought to establish nurse training schools to give patients care far better than that rendered by untrained employees. The School of Nursing continues to grow as a time when scientific knowledge and technological advancements require nurses to catch up to the expansion of medical care and treatment of patients with increasingly more complicated medical needs. While considering the best career option, it is important to know the best education options. An associate degree in nursing is a nursing school program that takes 2 or 3 years to complete, and it prepares nurses with the education they need in order to become registered nurses. A bachelor's degree in nursing typically takes 4 years to complete, and like an ADN, a BSN will prepare a nursing student to take the NCLEX, which is required to pass in order to earn a nursing license. Graduate education, master's and doctoral degree in nursing. For these nurses, they can function at a greater scope. For example, there are multiple community health clinics managed by nurse practitioners. The American Association of College of Nursing encourages all nurses to strive for higher levels of education to advance their capacity to enhance the quality of care available to our nation's diverse patient population. Calls for more nurses with graduate level preparation are coming from both inside and outside of the profession of nursing. Nurses consider a higher education for many reasons. Number one, answering the market demand. Nurse executives, federal agencies, the military, leading nursing organizations, and magnet hospitals all recognize the unique value that baccalaureate prepared nurses bring to the nursing practice. Nurses are responding to a need. Evidence proves there is a positive relationship between higher education for nurses and improved patient outcome. Nurses with higher education have proven success in case management, health promotion, and for their ability to practice across a variety of inpatient and outpatient settings. Competition. Nurses are valued for their skills in critical thinking. The hospital I work at and most employers foster environments that embrace lifelong learning and offer incentives for registered nurses. For those who are seeking to advance their education to the bachelor or higher degree levels. And these nurses are also seeking more opportunities because both ADN and BSN nurses can work a variety of bedside care positions in hospitals and other healthcare facilities. However, BSN graduate nurses do have the opportunity for additional career opportunities. As far as leadership roles, most leadership positions at my hospital require a BSN degree or an intent to pursue one. And lastly, they're looking for higher compensation. The salaries for ADN and BSN nurses at the bedside are usually similar to start off, but BSN graduate RNs do usually have more opportunity for higher earnings. According to payscale.com, the average salary for an ADN nurse in mid-career is about $69,000, while a BSN graduate might make as high as $84,000. The impact of higher education on nursing practice. The American Association of Colleges of Nursing, which is the national voice for academic nursing, believes that education has significant impact on the knowledge and competencies of the nurse clinician, as it does for all healthcare providers. It is believed that clinicians with Bachelor of Science in Nursing are well prepared to meet the demands placed on today's nurses. The Institute of Medicine has made recommendations for nurses to succeed in today's complex healthcare. They have to have deeper knowledge and competencies in subjects such as health policy and system improvement, research and evidence-based practice, teamwork and collaboration, and complex decision-making and leadership. RNs today work with an interdisciplinary team of physicians, pharmacists, and other colleagues educated at a master degree level or higher, such as physical therapists and speech pathologists. This team is necessary in the complexity of patients' care, and since nurses are primarily involved with direct patient care and care coordination, we should not be the least educated members in this healthcare team. As far as support for higher education, currently the average of nurses who hold degrees at the baccalaureate level and above is at all-time high at 56%, up from 49% in 2010. The AACN showed emphasis that hospitals hoping to earn magnet status must provide proof of plan to increase their BSN workforce to 80% by 2020. In 2018, New York became the first state to pass a law requiring nurses to earn a BSN within 10 years of becoming RN licensed. This law was called BSN in 10. Many other states are planning to adopt similar legislation. In addition, several large international national healthcare organizations already have plans in place to promote and increase their BSN graduated nurses. One hospital in my area has made all ADN graduates sign a contract to finish their BSN within 4 years of hiring. My hospital is offering scholarships for those full-time RN employees pursuing BSN degrees. HR at my hospital has also negotiated lower costs of RN to BSN programs with certain local and online colleges. Other countries like Canada, Sweden, Portugal, Brazil, Iceland, Korea, Greece, and the Philippines are just some of the countries that require a 4-year undergraduate degree to practice as a registered nurse. Online education, also called distant learning, has been increasing in popularity over the past 2 decades. Most students around the world have had a taste of it over the past year and a half during the COVID-19 quarantine. However, it can be challenging for those who struggle with time management and self-motivation. Although both paths have pros and cons, here are some valuable benefits for online classes. Number one, definitely class flexibility. And number two would be convenience for those with limited finances. They can take as many classes, as little classes as they need to. All those students who are able, allowing students who are able to keep a busy lifestyle with taking care of family and other things on the sides, and keep a full-time job at the same time. According to bestcollegesonline.org, the average cost of an online RN to BSN program ranges from as little as $25,000 to as high as $80,000. On the other hand, the average cost of campus-based programs, including tuition and fees, living expenses, transportation, books, and other supplies, is between $32,000 and more than $100,000 a year. Now, how to pay for all of this? Money is a huge factor when it comes to making that decision about whether or not to pursue higher education in nursing. Majority of schools that offer online RN to BSN programs offer the same types of financial aid as traditional programs. Through FAFSA, students may qualify for federal assistance such as federal Pell Grants and other grants, scholarships, and various types of loans that can help jumpstart the dream of higher education. These vary based on specific student needs, but everyone is encouraged to explore all of these options. One of the most important consideration to take when applying to an online nursing program is accreditation. Non-accredited universities shouldn't be considered if the goal is for the degree to be accepted in all states and by all healthcare organizations. There are two main accrediting bodies for nursing programs, the Accreditation Commission for Education in Nursing and the Commission on Collegiate Nursing Education. And the purpose of accreditation is to focus on the same standards and criteria across all nursing programs. The accreditation process ultimately improves the quality of nursing education and keeps the curriculum up to date on current trends and in advances in nursing and healthcare. In conclusion, with all the push and the opportunities that come with a BSN degree and a higher education, it is safe to say that this is what the future of aspiring nurses looks like. Bachelor studies and higher education have proven to make better nurses and offer a more comfortable living. Nursing is an evolving profession that presents limitless career opportunities for nurses with graduate degrees. Beyond the standards of nursing roles, nurses are breaking fresh grounds as specialists in fields like forensics, case management, military nursing, school nursing, genetics, and other emerging practice areas. It helps to know that several large healthcare organizations have put in place plans to promote and increase their higher educated nurses. Thank you all for listening and please find my references for more information.